I'd like to begin by acknowledging the traditional owners of the various lands, this being an online webinar on which we meet today. In my case, it is the Darawal Nation, and pay respects to elders past and present. I extend this acknowledgement to those of the attendees and panelists who identify as Aboriginal or Torres Strait Islander. So as per invitation, this webinar is a presentation of the My Health Record with an aged care bias, as well as the Telstra Health Solutions for aged care. We will try and cover as much as we can, but this will be very much an overview of the My Health Record system. After that, the presentation from Telstra Health will seek to show us the solutions as they translate, how that translate to their solutions and the My Health Record system. So for some housekeeping, as mentioned, the webinar will be recorded. The mic and videos, as you notice, has been disabled, but you can type in your questions in the chat. One of the panelists will either answer via the chat, or the presenter will address the question directly or through the content as they are presented. If there are questions that we will be unable to answer at this time, the question will be taken on notice, and we'll get back to you basically with the answer, and we'll use the email that you provided during the presentation. And if we could ask you to complete the evaluation survey at the end, just to help us basically improve on how we deliver this web types of webinars in the future. You know, some learning outcomes, and hopefully by at the end of this, we will be able to meet all of them. So describe the My Health Record system, its benefits to aged care residents, and what it contains. Pretty much most of these goals will be hopefully addressed by the presentation between myself and Sarah. So part of the evaluation is just to see how we did, and if you could answer whether we've partially or fully met these, or we haven't actually met these goals. So to start off, what is My Health Record? The My Health Record is a nationally available electronic health record, which can be accessed by consumers and clinicians to aid in the clinical care and clinical decision-making processes. Its intention is to provide an additional source of information which complements existing clinical information systems rather than replace them, enhancing the care clinicians can provide to health consumers. So in this slide, you can see that the summary means that implies that it does not contain all the bits of health information that a person have. So it is mostly a summary done through documents such as shared health summary, event summary, the discharge summaries, all of those documents that are allowed to be uploaded to a My Health Record system. It's personally controlled. A person has control over the access of their My Health Record by either by requiring a password before opening, or specifying who can and cannot access it, and discussing with their health providers what should be uploaded to their record. It is a national system, so every Australian would have one, except those who opted out when it became an opt-out system and available 24/7. The data itself is hosted and stored in Australia, and it is protected by the process of through the process of accessing it using username and password, plus a multi-factor authentication. Legislations are also in play. Both software and hardware security measures are also in place to protect the privacy and security of this health information. Some statistics. My Health Record has come a long way from the 50 to 100,000 records that we used to celebrate when it was still an opt-in model. This is around 2013. To the over 24.3 million records we have today, thanks mainly to transitioning to an opt-out model from the second half of 2018 to early 2019. So that's quite a big jump. We used to court patients, pretty much every person that we can that will listen to us, to please register to have a My Health record, and um, yeah, the transition to opt-out model is a boon to the number of My Health records now. So that's over 99% of all Australians have a My Health record. What's inside? There are 1.7 billion documents in the system, with the most of it being contributed by healthcare providers, mostly GPs and pharmacists. You can see that the consumers themselves, the 564,000 there, can contribute to the information contained within their My Health record. In terms of usage, the next graph tells us that pathology reports gets the most views, followed by diagnostics, imaging, and the specialist letters. It's in percentage, so it doesn't really, you have to account for the actual numbers. 54 million was viewed last year. And that's an increase from the 34 million, for example, of the pathology records. So that's a fair amount of records that are being viewed, mostly by clinicians, admittedly, but increasingly, more and more users, consumers, are actually viewing their My Health record. You can see the adoption of the MyHR by our health providers in this slide, with the GPs, pharmacies, and public hospitals leading the pack in terms of registrations and use. There are still some ways to go for specialists and allied health, actually, and aged care sector. So the Australian Digital Health Agency and the department are aware of this, and we expect more focus on these groups in the coming years to reach parity in both registration and meaningful use of the system. Now, what's contained in it? So the statistics presented before come from the different documents that are contained in one's My Health record. So as you can see, there is a variety of types that can be stored within it, and this can be contributed by the healthcare providers, the consumer themselves, and the different departments and systems which are connected to the My Health records, such as Medicare, immunization registers, and prescriptions, among others. Uh, there's a lot of it. I'll just go back one. As you can see, there's a lot of information there, different types, each containing different information. So as our health matures, our health record matures, this will become harder to basically see in one go. So conveniently, there are some smarts built into the My Health record system that enables us to consolidate the number of information in these various documents and present them in a summary form called overviews. Let's just go for an example to see how this overview works. So one of the most common ones, especially from the GP, are the shared health summary, which is arguably the most commonly contributed document by health providers. So from here, just from the definition, it will contain the medical conditions, the medicines, allergies, and adverse reactions, and immunizations. Another one would be another summary document is the event summary, which more of a point in time document. This is okay if there are only one or two documents like these in My Health record, but as you can imagine, it becomes unwieldy as our My Health records become mature and more documents are uploaded into it. Enter the overview. So with the medicines view, just for example, different doctors, or when you go to a hospital, another medicines might be introduced in your healthcare, and that might not be known immediately by someone who's just getting to know you as a patient or your resident as a patient. So these overviews are a good way of basically summarizing what's available to the My Health record, what's been uploaded to the My Health record, and consolidate it in a logical manner, so all medicines can be seen in one group. as well as immunization and say pathology reports. There are other overviews as well, but this just gives you a taste of what can be and what's available in the My Health record. Now, given our target audience is aged care and support plans are was actually asked if it will be covered in My Health record. Yes, it is a part of the My Health record. So care support plans, as you probably know, is effectively the wishes and how our residents slash patients can would like the provision of care to them would go. These are their preferences, and in discussion with those who are looking after them, they this can be put in terms of a template and uploaded to the My Health record of the person. Once this is uploaded, it will now be available for access for other health providers, and they will have a more holistic view of the care that the patient would like to happen to them. Now, advanced care plans is the process of detailing future medical care preferences, similar to the more generic definition was mentioned in the earlier slide. I'd like to get take your attention to the italics here. Please note that not only certain software we allow healthcare providers to upload advanced care plans to My Health record. Contact your software provider to check. This simply means that it's relatively new in terms of documents that can be uploaded, unlike the discharge summaries or the shared health summaries that are quite often being uploaded to the My Health record. So advanced care plans, please check with your vendors if to see if they have this functionality available in their software. If not, there is obviously the PDF version that a consumer or resident can upload, and it will be stored in the consumer section of the My Health record and can be accessed from there. Now, the residential care transfer overview, this is a function that I can confirm this later on in my debrief to you guys. But this is a function within My Health record itself that if a resident is moving homes, for example, you can use this to basically consolidate all the pertinent information that might be needed by the destination homes and the clinicians within them, so that the transfer and especially the health provision and the health service provision will be more seamless. This captures obviously everything within the My Health record of the resident, as well as whatever advice the current GPs and carers are have in their database and in their notes. So how does that look like? This is the overview. I'm not sure if you can be seen as clearly, but we'll share the slides anyway later on. So the residential transfer care will have these information. So the main the blue ones are the ones obviously that are essential. So it captures why they are being transferred, and what else is needed, basically, such as their medications, their current needs, and any immunization, and essentially anything that will be asked in anticipation of the transfer. um So that's a lot of information, not just about residential aged care, but also about the different summaries, diagnostic reports, shared health summaries, discharge summaries, the medications, all of these. So the more information we have, the more the better we can provide the health service, hopefully. So, with all this information available for authorized users, a number of potential benefits may be realized. Access to information that are usually source independent of each other allows providers to have a decision making aid that is more broader in its view. And because it is also available to consumers, they hopefully will be more proactive in their health management. So, this usually translates to the clinical task and how it translates to the My Health Record sections. So in this slide, we can see how the My Health Record captures and use the clinical activities that are when they are being provided to the resident. Just for example, the medication and reconciliation can be captured in the medicine's view, and and to avoid duplicate testing and scans, usually you'd call the hospital, another GP, or your chosen laboratories. But pathology and diagnostic imaging reports are also available in the My Health Record uh, section, so you can check that and you don't have to do those run around. It saves you from having that clerical overhead, and gives you more time to look after the residents. So if you're interested, the first step is obviously to register your organization. So you'll be authorized to connect to the My Health Record system. If you're already registered, your software needs to be configured to access the My Health Record. The organizational policies are next, then staff training, all of which your respective PHNs can assist you with if needed. So that's part of our job. If you're needing assistance or you're halfway and you get stuck with something, feel free to reach out to us, and we can assist you with that. Our contact details will be again shared at the end of this session. So how do you access it? Let's say you're registered and you can connect to it. There's two ways. One is if you're viewing and uploading of My Health information, the conformant clinical information system is the best way to do it. In other words, if your software is compatible with the My Health Record system, um, uh, this is the best way to do it because you can both view and upload in the one place. Having said that, though, the My Health Record function vary in application depending on the software. So please consult either the software manual or contact your vendor directly how they do the My Health Record functions within their software. If you don't have a conformance software or have no software whatsoever, the web-based National Provider Portal is your option to access the My Health Record. Again, we can help you with the setup of these. Uh, I would mention also for our residents or for us, basically, anyone with a My Health record, that the My Health app is also available for access on the go. And if you're installing it for the first time in your smartphone or smart device, look for these logo because there's a number of apps that are called My Health or similar to it. So look for this logo, and that's the one that the Australian Digital Health Agency has actually developed. So if you're moving on, if you're the uh, one providing care for your residents, you can access their My Health record within these conditions. The provider is permitted by the organization to access the My Health Record, meaning that you're an authorized person because of your role. By default, these are the nurses and the doctors that provide care to their residents, and the provider is accessing in order to provide healthcare to the patients. Being curious is not part of it, so you need to be providing healthcare to the resident when you access this. Whether they're there or not is a different matter, but the access of it should be in the context of providing healthcare. It is best practice to discuss this access with with your residents, as obviously health information are sensitive. Uh, Accessing your residents' My Health Record to upload. If you want to contribute the health information that you have locally, as in within your own clinical software, and you want to add that to their My Health Record, you can obviously do that with your conformance software. And after, like I said, this is where the discussion with your resident comes in. Um, Most of the time, they will say, yes, please add that information to my health record. In the case of them not wanting to upload it, again, that's a discussion that you can have if you're a health provider with them, whether it's a deal breaker that we really need to upload this so that they'll have a fuller picture of your health situation, or okay, it's okay not to upload it. But that's a discussion that you would need to have with the resident. The first time uploading a shared health summary, just for example, uh, it's best practice to have a discussion with your patient, and then it depends on the state or territory. Consent to upload um, is needed to when it comes to sensitive health information. Now we come to security. We'll just emphasize the personally controlled bit in the definition earlier. The first two is effectively that you can see in the slide is effectively they're requiring a password before viewing a document or the entire My Health record. So you can put a password on specific documents or your entire, as a resident, or their entire My Health record, saying that every time you want to access My Health record, I need to give you a password, or you need the password to open it. Uh, in terms of removal, or basically curating what's in the My Health record, this is where that discussion that I mentioned earlier as well comes in. The consumer can ask the author of a document to remove what they uploaded. Note that you have to be the uploader of the said document, so you can't delete something that has not been uploaded by yourself if you're a health provider. Again, this is a discussion, obviously, between you and the patient or the resident. The fourth icon there is that basically, essentially, that's you receiving an alert that your My Health record is accessed. The default here is every time your My Health record is accessed for the first time by an organization, you will get an SMS. That's how my my own My Health record is set up. Um, and all instances of access to My Health record are monitored and logged. This log will detail what you have viewed in terms of sections, whether it's the medicine or the allergies um, or the immunization. Now, there's an emergency access provision. Say, for example, the situation is it's password protected, but unfortunately, a healthcare needs to be provided to a patient or resident, but they are unable to give consent. So this is where that emergency access provision is comes into play. So You must reasonably believe that there is a serious threat to the life, health, and safety of an individual, and reasonably believe it would be unreasonable or impracticable to obtain the consent of the healthcare. Say they fainted, they're unconscious, whatever the reason is, they're unable to give the consent right there and then. And then you have to reasonably believe that it is for the general public good that you access this my health record at this point in time. So the My Health Record security, as mentioned, is there's many safeguards to it. I think the phrase is security or defense in depth of the actual My Health Record system. So there are many safeguards that are in place, both hardware and software, as well as legislation, as you can see in this slide. The most obvious one as users, for example, would be the user name and password that are in place every time you log on in the MyGov site. And then there's the multi-factor authentication that will ask for a code even though you have the username and password. These are encrypted as well. So even if they're trying to hack, they have to get through a effectively a military grade encryption walls, secure login processes, and in the firewalls of the system itself. It is actively monitored by the agency's cybersecurity system, and any attempted breach or even suspicion of a breach is looked at quite seriously. Um, Later on, the next slide will mention about the legislation. All data within the My Health Record system, as mentioned, is stored securely in Australia, both the physical location and not just logically. And external software goes through a conformance process before it is allowed to connect. So in terms of legislations, there's a number of them that are in place specifically, some of them specifically for the My Health, the regulation of the My Health Record system. I won't bore you with the details of it, but they are available for public consumption if you're interested in it. So now, there's also, I need to mention because we're in an aged care setting, the nominated and authorized representative. Basically, these two are if you're a resident but you're unable to look after your My Health Record themselves, you might nominate a representative. Nominated representative are usually the ones who are looking after you in a professional capacity in the provision of your health care. The authorized representative by default are usually related to you. Parents, for example, are automatically the authorized representative of their children and those who they look after, like their elderly patients. There are processes to be an authorized or nominated representative for this, but effectively what they do is you have access to, once you become one, you have access to the My Health Record of that person, and you can do pretty much anything on their behalf, sort of like a power of attorney type thing. But obviously, this will need a lot of discussion with the owner of the My Health Record, the resident or the patient themselves, and and once everything is agreed about the boundaries of your representation of them, that can be put in place, and you can apply to be either a nominated or an authorized representative. That's a lot, and I flew through all the information. So I will be handing over now to how that translates to, say, a software. In this case, the Telstra Health Solutions for Aged Care. We will be looked after by Sarah Evans. She's the senior product manager for the Age and Disability department of Telstra Health, and she has more than 18 years of basically of experience in this field. And sharing with this is the I'll hand over to her so that she can so that we can see how it looks like, how Telstra Health looks after this one. I will stop sharing and
Thank you.
over to you,
Get that
Sarah.
picture off. Thank you very much. Hi, everyone. For those that have just joined, really excited to be invited today by the Southwestern Sydney PHN group, just to walk you through our solution. As we mentioned, there'll be time for Q&A at the end if there's something that we couldn't answer during the time. If there's a question that you want to ask, please add it to the chat. I have my colleague here today, Febin. I'll just get Febin to introduce herself.
Thanks, Sarah. Hi, everyone. My name is Febin Amir. I'm the product owner for the clinical manager and caregiver team. I've been with the product for over 8 years now, so I'm really excited to hear your questions and queries about our software. I'll hand it back to you, Sarah.
Thanks, Febin. So if you've got some questions, please put them in the chat and Febin will be there to answer them, and anything left over we can get to afterwards. So I will log in. Oh, won't log in. I'll share my screen. Okay, great. Just put that little icon there. So what we have here is our landing page, and I'm just going to go through with my health record, just looking at the percentages in aged care as well and how it is increasing. We've had a My Health Record connection way back when it was called eHealth, I think, and there was another organisation within the department who looked after it, and we only had probably one or two organisations who were using it. That sort of has increased over time, and we have seen since Royal Commission and Aged Care Act has come out, a flurry of more clients who are wanting to get on to My Health Record. And I think the legislation change around the pathology and diagnostic, I think, or radiology, I forget which one, where it's added the information in there, you'll see more and more information being added to My Health Record, and a lot more clients of ours are really interested in connecting the My Health Record to their clinical manager product. So the other way that the way that we've found that clients are using it currently, especially in rural and remote areas, we have organisations who have set up a bit of a community hub and ensuring that everyone around them and specialist services, hospitals, GPs are all putting information into My Health Records. So on admission or pre-admission, there's some tasks and information that can be done prior to the resident being admitted to the aged care facility. So it really reduces that time that the registered nurse or manager might have to take in gathering a whole lot of information about the resident, and it also takes away the time. It gives more time back to welcome the resident to the aged care facility and make them feel comfortable rather than questioning them. You're probably more confirming information because you have a lot of information about that person before they come into the aged care facility. So there's a couple of things that were mentioned during our, I've locked myself out. Now this is our test environment. You may see some interesting names, hopefully not, or some data that wouldn't be realistic because it is our test environment. So if I just go to resident and I'll just jump into Billy to start with, and I just wanted to show in our product here, we have the information around consent. So each document that is able to be uploaded to My Health Record, you can take speak to the residents about their consent. You can mark it in here whether it's approved or not. So if they don't approve for a particular document to be sent up to My Health Record, the button won't be there, or you'll have a message to say that it won't be uploaded to My Health Record. So it won't prevent you from doing a process, but it'll just mean that document doesn't get uploaded. So that's the consent part of things, and I'll just go to Basil, and we'll jump into My Health Record. So we have a My Health Record tab that you can see here. So if you have access through Clinical Manager as a user, there's permissions around that, and particular numbers and things, HPIIs that need to be entered, etc., then you will have access to the My Health Record tab. So when you first go in, you will see all of the My Health Record documents that have been loaded and added to My Health Record. So you can come in here, as I said, pre-admission or at any time, to see if there is something that you need that's been loaded up to My Health Record. It might be a pathology result, it might be radiology, it might be a discharge summary from a hospital, for example. I know lots of people are interested in the immunisations, so if I just do a keyword search here, you can see the immunisation consolidated view. So there are a number of views that are available in My Health Record. So for example, if I type view, you will see there's a medical conditions view, medicines view, and also immunisation consolidated view. So they're views where My Health Record has pulled all of the information together about immunisations, for example, that might have been uploaded from different areas, and put that in a consolidated view for you. So you can view that information through our system here. And you can see here, I'll just make that a bit bigger for everyone. You can see here the immunisations. You've also got shared health summary and an event summary. So if you page down, again, this is test data that people put into the My Health Record, but you can see here the immunisations will be listed that Basil has had. You've got your shared health summary information that someone has uploaded as well, and some information about Basil there. I'll also go to the pathology overview to have a look here. So when you click view, what that's doing is that's going off to My Health Record, grabbing the documentation and presenting it back into our Clinical Manager product. So this is a pathology report that has been uploaded. You can see Canberra Health Services have uploaded this document. I'll just click on this particular report here, and you can see this is, again, their test, but this is how you would view your pathology information that's sitting in My Health Record. I'll just do another one here as well. I'll do diagnostic imaging. And we've got this here. So you can see there's a couple of hospitals that have some diagnostic information in here that have been added to My Health Record, and you can view those reports. So I'll click on this one for arm or elbow. Again, this is test data. So you might actually see a radiology image or the actual report, depending on what's been uploaded there. The other thing that we have in our product, if at any time you wish to save this data, so rather than searching for it each time, because there may be a mountain of documentation that is sitting there for a particular resident, you can download the selected documents. So what that will actually do in our particular product is that will put the documentation into an area where anyone who has access can come in and view that downloaded documentation. You also have the capability of any of those reports and things like that as downloading them as PDF and again putting them in your clinical system. So if I go down to downloaded documents here, you'll see these are the ones that I have just downloaded now. The other thing I wanted to show is the prescription and dispense view. So that actually consolidates all of the prescribed and dispensed medications for a resident, for a resident in aged care. I'll talk like that, resident in aged care. So what I'll do is I'll just put 1st of February 2024 and filter. So what this brings back is all of Basil's medicines. I'll just put it in brand name view. You've got a few different options to choose from here, and you can see when it was all of the dispensed information. So this you've got your perindoprils and insulins, etc. Your simvastatins that have been prescribed and what has been dispensed. So you've got that information in there. So that, again, that's really helpful on day one as part of an admission or maybe a transfer or coming back from hospital to get some information around what medications a resident is currently on. So you can show the GP can come and have a look as well and start creating those charts either prior to admission or very close to that admission date, just to help with those processes. I just also wanted to go into another resident. Go into Kiralee Arnold here. She had a discharge summary that I thought that you would like to see. So I've got a discharge summary here, so I'll view that discharge summary. So this is a discharge that has been added to my health record from a hospital. So if in your area or if the hospitals that your residents are going to is using my health record, or if they're not, try and encourage them to do so, but more and more will be, then they'll put a discharge summary in here. So in this example, you can see some of the type of information that this particular hospital has put into their discharge summary. So we all know the bits of papers that often come back from hospital with the resident on transfer may get lost. There's often a lot of questions that you need to ask. So this gives you a lot more information, especially around the clinician details and the types of information with contact data in there. So this sort of information is usually filled out. So that's a really good document as well that's put into my health record. And the other one I wanted to show, just specialist letters as well. So there's specialist letters that can go in there, referrals and things like that might be put in. So again, this is a test document, and you can see this particular specialist is adding quite a bit of information in that you will have access to view. And you've got that download capability as well. Now in our software, we've got the ability to create an event summary if there's a new allergy or if there's something that's happened with the particular resident with any of these areas here, some immunisation, procedures, any information that you think is relevant to add and be viewable within My Health Record, then that is available for you to upload to My Health Record. So I'll just do a quick one here. We'll say I'm the third. Spell check, which is good because I'm not a good speller. There's a new allergy here that's been added, so I wanted to make sure that everyone who views My Health Record information sees that allergy. So what I'll do is I'll complete that. And I can view now, this is the document that will be uploaded and be able to be viewed within My Health Record. You can see the gluten there. The message that I've put in would more than likely be more informative than that. And then you can upload to My Health Record. So again, all permission-based and that consent that I was talking about before if you don't have consent there. The other thing I've realised, just the time that we have, the other thing I wanted to show was just in relation to advanced care directives. So through our software, as we know, in aged care, it's probably one of the first times the resident and the families have had to talk about an advanced care directive. So it's more than likely that it is the aged care facility who will be uploading that. Of course, you can search prior to admission or at any time if there is an advanced care directive that's been uploaded. Maybe there's one of the apps that is being used, like Touchstone or one of the other apps that are available around advanced care directives. What you can do here is I'll choose Basil and we'll upload a new document. So I'll just type in Basil here. Advanced Care Directive. I'm going to make sure that it's filed, all the documents are filed for advanced care directives in my organisation there. And you can see here you've got your upload advanced care directive planning to My Health Record. If Basil hadn't consented to that, then you wouldn't see that option sitting there. So I'll just quickly choose a file. Conveniently, I've got one sitting here. And we'll view in progress note as well and save. So that now saves within your clinical manager. You've got a progress note and it's also gone up to My Health Record. Now, the last thing that I wanted to show you is hot off the press and something that isn't available yet, but will be around the end of August, beginning of September, is the hospital transfer report. So there's a lot of information and we know how hard it is and all of the information that an aged care provider has to provide as part of a hospital transfer and the information that the hospital might need or, as was mentioned, transfer to a new aged care facility. So we do have this transfer at the moment, which is fairly manual, but it doesn't enable you to download and print a whole lot of documents that may then go with the patient to hospital. None of that actually is uploaded to My Health Record. So we want to make the process as easy as possible, ensure that the good, rich data that's needed when someone does go to hospital or transfers is in My Health Record and is also available if you want to print, if you want to save it as a PDF, etc. So we've got a mapping piece here, hospital transfer report configuration. So these are all the mandatory fields that are required by My Health Record to be added as part of a hospital transfer. So you've got your primary reason for transfer and you've got action taken. We've also got these bits here. Emergency contact, you can choose, if you don't want the primary contact, but let's have the primary contact and the doctor as what happens and is pre-populated. If I look at medical history as well, what we're including is a whole lot of information that is sitting in an assessment form. So in Clinical Manager, we have a medical history assessment form, and that's usually filled out for all residents. If you wish some of that data to be uploaded as part of transfer, you can map it here. And every time someone is transferred to hospital and you create the report, it'll pre-populate the data for you. You've got your procedures, you've got level of consciousness as well. And what I'll do here is I'll just add some information from this. We've got a question here that if you have filled out that assessment form, the data will be pre-populated in there. So I'll just save that. And we've got some information around diet and fluids as well. So what I'll do is I'll just go to Omar. And as you can see, Omar's gone off to hospital. So you can create this report either before or after. We know there's a lot of work that happens if it is an emergency hospital admission. So you can do this at any time. So I'll create a hospital transfer report. There's some non-mandatory fields. You might want to fill out some additional information. So you can choose to have these fields added and confirmed. This is the first time I'm trying this with Omar. So again, you'd put some more informative information in here. And I'll click next. So you can see based on what I configured originally, you've got a whole lot of data that's being pre-populated. I wanted my primary contact and doctor information. It grabs your allergies, any diagnosis or medical history. That one, I haven't filled out the assessment form, so you'd add your information manually in there because it hasn't been pulled across from an assessment form. You can see this, all your blood pressure data, your pulse, respiratory rate, saturation levels, all of that information that you may need to be supplied with has been pulled across from our charts. Now, we do recommend that probably data within the past 4 hours, so all of these fields are mandatory, and you can see the time here. So someone obviously updated that prior. You've got your weights being pulled across, and you can see here you've got your level of consciousness that I mapped as well, and I've filled out that assessment form previously earlier today, surprisingly, because of this demo, and the same with your diet there. Okay, so it just gives you your assessment form here. Sorry, not your assessment form. Gives you your transfer report. You can see how easy it is, and then all of that data will be uploaded to My Health Record once you press the upload button, which is in the middle of being developed, so I won't be able to show you that today. And we've got 2 minutes left, unfortunately, for Q&A, but I hope that that demo of the Telstra Health offering for My Health Record has helped you to understand how clients currently use My Health Record, the benefits of My Health Record, and the type of data that is available there. So I'm just wondering, Janvier, do we have some Q&A now if there's questions in the chat that haven't been answered that we might need to answer?
Yeah, I believe most of it has been answered, and I can be corrected. If not, we will certainly take those questions, and probably the best way is to, even those that have been answered through the chat, we'll just put that as I suppose a debrief to those who have attended this this webinar. So there are just in the interest of time, there's a number of other resources and further information about My Health Record, and obviously Sarah and her team at Telstra Health will be more than happy to field questions if you have any about their solutions to this. For the My Health Record, there's a number of information there. if I can. Yep. So again, these slides will be shared to everyone who has attended. And if you have any questions about them, you can contact them directly at myhrregistration.rac at digitalhealth.gov.au. And of course, your respective PHNs, depending on where you're at, will be more than happy to lend a helping hand to your queries. And finally, how did we do today? So hopefully that's the answer is good, but we'll take the feedback from you and take on board the lessons and comments and whatever critique you have of our presentations, from content to presentations, and then we'll use that to hopefully improve our future webinars in this one. So please take a moment to fill out this form. They're quite quick and they're multiple choice. So you just need to click on a radio button and off you go. Within 5 minutes, you're done. But thank you for joining us today, and we hope to see you more in upcoming webinars. So I'll keep this uh, QR code on there just so you can provide us with your feedback. Thank you to Sarah and Febin, and for all our panelists who have answered the questions. If we are unable to answer the questions right there, we will answer it through a feedback form, like some sort of debrief, a post webinar answers. So thank you, and hope the rest of your afternoon goes well.